I'd like to welcome you here today. We're talking, it's a first ever Métis table talk on prostate cancer. It's an honor to talk about men's health. If you look around in Métis health, have we ever done anything on men's health before? I'm not aware. No. And as I say, I think this is something that we really need to continue to address in the future. And it's such an honor. Just a few housekeeping things. Make sure that you are on mute. And during our presentations and the chats that we're having, if you have any questions, please type it in the chat, and we'll be keeping an eye on that. And at the end, we'll answer your questions. It's also going to be recorded. So if you have any concerns with it being recorded, you can leave the conversation and then watch it later at a later date. It will be posted. But without further ado, I'd like to introduce our Senator Alan Edkins, and he's going to give us the opening, traditional Métis opening.
Thank you. Bienvenue, mes sœurs et confrères. It's indeed a pleasure and honor to be here today. And I must agree with our spokesperson that I have never attended anything that's spoken about men's health. And it's one of the things that I think because we were raised in the old days that men were silent, looked after their family, you didn't say anything, and it was a topic that wasn't at the supper table. So if you would bow your heads with me, I would give us a traditional opening and bless everybody and hope that the people that are here live in health, especially through what we're going through. Et bon Dieu, Enosh, Kishnewan, Ki Maisha Pe Pinanan, nos soldats pour le sacrifice ont qui le brève oich, Kimian Kishpian Chi, ni Pichuit. The Métis Wichik, Oishwan Lichi, a Tushki Kiachak. Sotul le vieux chi, awa, poe chiako. Eritien, Kishmi, Moyoachak, Politon le bien. What I said basically in our other language, English, today, Lord, remember our forefathers, our Métis war veterans, and the sacrifices and their braveries they made for us at all costs. Help the Métis work together, especially utilizing our elders as teachers and preparing our youth for the future. Merci. Tip one.
Thank you very much. It was an honor for you to open our podcast today, Senator Adkins. Very much appreciate it. There's definitely words of wisdom there, and it's a great way to open this up. I'd like to introduce myself. My name is Lloyd Main. I'm a proud Métis member of the Vernon Métis Association. I'm also a proud father of 2 young men, and I always brag about them, but one's a physician and the other one's an engineer. They are the future of the Métis men. And I'm hoping that one day they'll be able to sit on here and share their knowledge with us. I sit on the unceded traditional land of the Squebnik people in the Armstrong Vernon Salmon Arm area. I'd like to introduce a couple of our special guests. One is Destinée Barrow.
Hi, everybody.
She is an incredible person, and I can't say how it's an honor to be working with her on this project. Our other special guest is Dave Armitt.
Hi, all.
And unfortunately, our other special guest was unable to attend due to some health issues, but he did record his story and we will share it with you. So let's get started about the journey of prostate cancer. It's kind of the man's Achilles heel. And why do I feel it's so important that we talk about it? First of all, it is the #1 incidence of cancer amongst men. Fortunately, it is only the third highest mortality for men. And the good news of the whole thing is there's a 93% survival rate over 5 years. So that is really good news. And so you want to put it into perspective, 1 in 9 men will develop prostate cancer. Fortunately, again, as I said, only 1 in 29 men will die of it. So that's really a positive for me. And another thing about it, since 2011, prostate cancer has rapidly declined in men. And that can be kind of runs a parallel course with the diagnosis and men being more aware of the risks of prostate cancer. So that's really exciting. And I think that's chats like this, I think that will even help improve our survivability with prostate cancer. I'm not going to get into too much more than that, but I really think it's important as we go through this to think about what our fears are, what our concerns, what we've heard, some of the urban legends, and add those to your chats as we go through. Because I'm 58 years old, and I definitely have had friends and family members and friends of the family that have gone through prostate and have shared some of your stories. And unfortunately, I've only heard the bad stories, and those are what stick here in the back of my head. So I really want you to think about that and bring up those questions and concerns, and we as a group can chat about it. And we want to keep this a low-key, open as we go through it. So without any more ado, we'd like to introduce Leo, who at 56 was diagnosed with prostate cancer and is a survivor, has some other health challenges related, but we're going to introduce Leo.
Thanks very much, Lloyd. I just wanted to share a little bit before I go ahead and share Leo's story with everybody on our call today, that he really wanted to be here in person. And this was not his choice to be coming to us by video, but he was so committed to participating in this, and his willingness to get out information and destigmatize prostate cancer was really important to him. So I'm very pleased to be able to share this video with you, and I'm going to go ahead and screen share with everyone now.
Yes, I am one of 10 children, and I thought it was very important to let my story out, because when I was diagnosed with prostate cancer, I was very quiet about it. I did not tell anyone. And after thinking about it, after my brother didn't tell anyone, it was sort of detrimental to me, because I could have probably caught it earlier. So once the doctor and I had our conversations, he sent me for x-rays and so forth and so forth. Then he sent me to an oncologist, and I had a meeting with the oncologist, and that's once you meet with them, they give you your options. And my options were radiation, 2 types of radiation, or surgery. And so I talked it over with my wife. I talked it over with her a lot, and my 2 children. And I just said, you know, I really don't want cancer in my body. I said, so I'm apt to go for the surgery, even though the side effects are at the time, back then, they were sort of, you know, detrimental to your manhood and everything. But in today's world, well, back then they even had medication for you. So I went through the surgery. I was in the hospital for 3 days. I went in the morning. They took my prostate. Then the next day, or no, I was there 4 days. 2 days later, they let me go. And the only problem when they let you go, you have a catheter, and in the catheter you got to have it for 10 days. So that was sort of very hard to deal with, but I dealt with it. And all in all, I think it was probably the best thing I done was get my prostate removed. But that was my choice, or my family's choice. The doctors, they give you lots of good options. And then the recovery wasn't too bad at all. It takes about a couple, 3 weeks. And then you're onwards and upwards, I guess you say. Just trying to think. Then the most important part of it is that, I guess, talking about it. You got to be able to talk about your problems. Your friends and family, they don't want to harm you or demean you or anything like that. All they want to do is help you. And I think you have to get that through your head that if they want to help you and the help is there, then you got help. You got, instead of trying to hide in a closet, just hide so that, no one knows what's, they, like some of my friends were saying, what's the matter with Leo? What's the matter with him? How come he's so, this and that? And I realized that quite a while after that, not talking about it wasn't helping me. It wasn't helping my friends. It wasn't helping my wife. It wasn't helping anyone. You have to talk about it to get through it, to understand it, and you try and find somebody. Like, I've talked to several people that have had prostate cancer, and they went from, like my oldest brother, he ended up just getting the radiation. And then I had another friend that had prostate. He used the radiation with the little beads. They actually put beads on it. And that's how they go after it. But I had the radical, they call it. And it causes some problems. I ended up with some incontinence, which means less control of my bladder. But you talk to the doctor, I spent the night in the hospital, he fixed me. Everything you be honest with your doctor, you be honest with your friends and people, they'll always help you. There's no people like people don't, make fun of you or anything like that. I don't believe anyway. It's not my friends and family, but it's I just think it's something that people should understand, that it's something that happens to men, and you have to get checked, and it's not demoralizing. It's even if you have to get the internal, it's just a part of life, a part of going to a doctor and telling him you got a cold. He checks you, he does all of his checks on you, and that's how you end up catching it, and that's how you end up dealing with it. Like I say, I dealt with it, and that's in 2012, and I go see my doctor once a year. Not with COVID though, but once a year I go with him and I get the blood test, and he reads my PSA, and as long as it's at 0, he's happy, I'm happy. And that's the way it's been since 2013, I guess. So, when I first was diagnosed, my PSA was up around 12. My Gleason, I think, was up around 9, which are ways to measure how advanced your cancer is. But it's your prostate cancer, and they just test. And then you come to a conclusion on what you want to do about it. And basically that's my story.
Thank you, Leo. I'm wondering if you could tell us a little bit about your experience dealing with the cancer care agency and what that was like, because I think some of our listeners might be interested in what it was like engaging with the Canadian Cancer Agency or the BC Cancer Agency, and what that was like for you.
See, that was the different part. Back in 2012, there was no cancer agencies there that I knew of. I never went to it. If I would have got if I would have had to get radiation, I would have had to go to the cancer care. But there was nothing. I lived in Kamloops at the time, and there was really nothing except you seen your doctor, and he dealt with me. I didn't need any. I just needed the surgery, and after the surgery, I didn't need any further treatments. So I'm sort of a little different than thing. I have recently dealt with cancer care, and they're the most lovely people you ever met. You know, so they're very caring, very knowledgeable, and very
Leo, can you tell us a little bit about what kind, if any, supports were available for you when you were dealing with cancer, or what kind of supports were available for your family? Was there any resources that you were able to access to kind of help you along your journey or help your family?
Yes, there was, but like I said earlier, I kept it very quiet, and I did not pursue any type of care. And I might have if I would have had to get treatment, but just after the surgery, that was sort of the end of my prostate cancer. You know what I'm saying? Yeah.
Is there resources available for your family? Like, how did you talk to your family about having prostate cancer? How did you approach it?
Very, very carefully, very, very sadly. I approached it once I found out from my doctor, which I was by myself when I went and seen him, not expecting to be told that. And then I went home and I discussed it with my wife, and I just said, "I think we've got a problem, hon." and I says, "What are we going to do? What do you want to do? What are we going to do?" And I said, "We got to talk to the kids." And I says, I really don't want to talk to anybody else. So we didn't really look for resources. We sort of leaned on each other, because my oncologist, actually, he was very positive with me. So, I mean, if you had to say a resource, he was a great resource. I don't know, like, and literature, books. I always pick up books. Back in 2012, the internet wasn't as good as it is today. Like today, I would research it top to bottom, side to side, and like, in cancer care, when you go there, there's books everywhere. You can get any book, anything you want, you go on to BC Cancer Care and you go into it, and you go into bccancercare.ca, I think it is, and then there's every bit of information you want there. As unlike before, like I even back in 12, I was looking at alternatives procedures also.
Oh, that's interesting.
Yeah, but I didn't, like I say, a lot of the unsurety came from the doctor's appointment to the oncologist appointment. And once you get to your oncologist, I believe they know more what's going to happen. Your family doctor keeps in touch with everything, and he keeps on top of everything, but your oncologist, he's the one that really makes you feel comfortable.
I can imagine that when you're first given a diagnosis of prostate cancer, that so many things probably just start rushing through your mind, and it's the GP or the family physician that gives you that initial news before you get sent into the professionals. So I've heard that more than one time, is they don't necessarily set you up for success in the GP's office, but I'm glad to hear that if you have to go and receive cancer treatment, that it's a, it's a positive experience for what you're dealing with.
Yeah, actually, I was going to say the doctor, when he tells you you have cancer, I've got this experience a couple times now. That's the last thing you remember in the meeting. Everything that they talk about after that is you don't remember, and that's why you should always I wish I would have had my wife with me at the time, because when I heard it, everything else went blank. So when I got home and I started telling her, and she says, well, and I said, I don't know. I don't remember. And I've heard that more than quite a bit, that people just, once they hear the word cancer in a doctor's appointment, that's all they remember is that word, and then it goes from there.
What do you think that you could say to other men and even other spouses or children or others that will be listening to this video now and in the future, that you would kind of give them as sorts of words of advice based on what you've been through? How about, first of all, to the men? What would you say to the men or males listening to you today?
To me, what I would say to them is that don't be afraid to be tested, and because it's better to know than not know, and be open about it. Don't be afraid of it. They claim that all men in their upper 80s will have cancer, some kind of prostate cancer. So, if you got it, it's better to catch it and to deal with it. And I suggest that men should get tested.
And how about those that are supporting men? So for the women that are listening, wives, daughters, sisters, what would you say to them?
What would I say to them is to support your man. Because I'll tell you, if it wasn't for my wife and my kids, it's a tough thing to go through. So when you talk to your wife and kids and or just your wife or your mate, or your partner, that's what you need. You need to have someone to talk to, so you can put it in your mind how to deal with it, and the best way to deal with it for yourself and your family.
Can we give a shout out to Mrs. Sanderson?
Hey.
Yeah, that's my wife. She's a pretty good one. She's a keeper.
That's awesome. Well, Leo, it's been absolutely amazing listening to you tell your story, and I know that you really wanted to be able to join us in person when we're actually doing our program tomorrow. But I just want to thank you sincerely from the bottom of my heart for taking time out of your evening to contribute to our program. And I hope that in the future, if there's a way of, if people have questions, or if they want to reach out to you, I'm not sure what your thoughts are on that, but we're so grateful to you to take time out of your day, and to Mrs. Sanderson as well for lending you to us.
Okay,
so
no
you
problem.
probably have to get going and continue with your evening, but I sincerely want to thank you tonight, sir, for your bravery and for your contribution to the Métis Nation and other Métis people. Thank you, Leo.
Okay, thank you, Des.
You have an awesome night.
You send me an email on how I can watch this.
Wow.
Isn't that an
exactly.
amazing story?
Yeah. There's lots of things that he said that really hit home to prostate cancer, period.
Yeah. Leo is an amazing guy, and I really felt very honored that he took time out of his evening, as I said, after everything that he'd been through, because it was really important that he get to contribute to the work that we're doing today, and then also, to advocate. And I think that, advocacy is something that is really important, and I'm looking forward to that discussion.
Yeah.
Yeah, what a story from Leo. It's so powerful to hear his journey. One thing he did leave out that he shared with us in one of our previous conversations is the fact that he was pretty well asymptomatic going into the doctor's office, and what got him tested, and he got the PSA test, and that was the thing that tipped the diagnosis, is his older sibling had just been diagnosed with prostate cancer. So that was what he went in with. And believe it or not, that is the number one precursor to prostate cancer, is having a hereditary link. So that was something that he might have shared earlier with us, but not during this. And Destinée, awesome job. You did a great job. That's such a powerful story. Thank you so much, Destinée.
Well, I'm grateful to have the chance as a woman, someone who supports men in her life. It was really great for me to listen to Leo and hear what he had to say about, what could I do if someone in my life was dealing with prostate cancer? Because it's a male's disease, but there sometimes are females that are supporting males. So it was really powerful for me as well to be able to sit there and talk with him.
Yeah, certainly that. Although it's a male's disease, the females and the family are affected by it. So it covers everybody, not just the male who's got it.
Excellent family. Yeah, and I think it's for any person that has a health issue, whether it's cancer or any other health issue. It just sort of highlights the importance of having a strong support network to go through that journey, to support you with all your needs. And so, and as he said, he's got a keeper, how his wife really helped him through that journey. They walked hand in hand together. And I think that to me really hit home how important it is to have a support person.
Yeah, certainly. You had mentioned earlier, Leo, about early diagnosis and stuff like that, Lloyd, and Leo had mentioned that he had no symptoms at all, and only that his older brother, who had been diagnosed with prostate cancer. I feel that the reason a lot of men don't get diagnosed are because they're not getting checked. And there's a stigma about that. And the stigma is the type of check that has to be done. Nobody wants that. But as you had referred to, that there's a 93% success rate if it's caught early. So, doing the math there, wouldn't it be more simpler to get the tests done that need to be done to find out, so that early treatment can be effective?
I agree with you 100%, but it is, men have a tendency to be very prideful, have a lot of pride, and having to hop up onto the stretcher and grin and bear it all, and then be examined. I mean, it is at first a little hard, but as I said, for 26 years, I've had a female physician, and never once did I ever feel I was it was in a disrespectful or affected me. And I've had my prostate checked since I was 45, which is early, because basically you should start around 50. That's what they generally recommend, but 45 for people that have some genetic history to prostate CA, or if you're, believe it or not, Afro-American, that you have a higher incidence of prostate CA. So they should start at 45. But I've, for reasons, I started at 45. And I've had my PSA pretty well taken from that time forward. And for those people who aren't aware of what the PSA, and that's what diagnosed it for Leo, is it's just a marker in your blood that is specific to an antigen for prostate. So I've had both a digital and my PSA every other year checked. And I'm glad to say everything appears to be normal so far.
Good. Yeah, so when you talk about digital, and it could be that some people here don't know what that means. I mean, for most people, when you say digital, it's technology. So that is probably one of the stigmas right there. The digital just means a finger exam, and the doctor physically examines your prostate and has to do that through entering into your anus. That is a big stigma for men. I know when I was a young soldier in the military, we used to make fun of the older guys, anybody who was over 40, because they used to have to go get a specific medical check. They call the over 40 medical, but we knew they were getting the rubber glove treatment is what we used to call it. And so it kind of bred that stigma, like, I don't want to turn 40. I don't want anybody sticking a finger in my butt to get checked. But, when you look at the statistics of it, and Leo kind of mentioned it a little bit as well, that elder men, older, in their 80s, likely have some form of prostate cancer that they don't know about. As you mentioned, they're asymptomatic. So the PSA test and the digital test are the two ways that they're going to determine that, and that's a stigma that men need to get over. It doesn't hurt. Although there are jokes about, the doctor doing a PSA test. You say, "Oh, doctor, your ring's hurting me." So that's not my ring, that's my watch. That's not the case. It doesn't hurt. It takes a second. That's a little bit of military humor thrown into there. It doesn't hurt. It only takes a few seconds. The doctor is actually examining the back of the prostate for irregularities. For men that don't know it, and women as well, the prostate's about the size of a walnut and has the texture apparently of a walnut. I've never felt one myself, but that's what I've heard. And what the doctor's feeling for is irregularities and lumps on the prostate to determine whether or not there's cause for concern. And as you mentioned, the PSA test. And the PSA test is just a regular lab test that the doctor can give you the requisition for and go. So yeah, there's a stigma there.
So, Dave, I'm going to turn the next part of the conversation over to you. Dave, him and I've been we've been talking since September. And I've been really impressed with Dave. He's a MNBC Métis veteran chair. He's been involved in prostate cancer awareness through the motorcycle ride for dad for prostate. He's a really strong advocate. So I'd honored to introduce Dave Armitt. I'm going to hand the floor over to you, Dave.
All right, thanks, Lloyd. Yeah, I was one of the co-chairs for the Motorcycle Ride for Dad, and its name is actually changed to the Ride for Dad because they've transitioned into a few things, and I'll talk a little bit about that. I got involved with it because I'm an avid motorcycle enthusiast, and as a veteran, there's a group of us here in the Comox Valley who ride together. And just one day, a buddy of mine, he and I were outside a local coffee shop, and both motorcycle riders. We'd actually ridden to this coffee shop, and we heard all these motorcycles running around. So this was in spring of the year. We thought, we should try and get some sort of a rally or a ride together here in the Comox Valley because there didn't seem to be anything. That weekend, I saw a video clip from Victoria that the Motorcycle Ride for Dad had an event in Victoria, and it was for prostate cancer awareness, and that's what got me involved with it. So my buddy and I decided that we should approach the Ride for Dad, and they're a national entity that hosts events all across Canada. There's not so many in British Columbia anymore. I think Kamloops or in the interior or Okanagan is the only place now. But there used to be one in Victoria, one in the Comox Valley, one in Vancouver. and so forth. And what they do is it's a charitable ride, and it works off of pledges where the local ride will have like a poker run. In a motorcycle community, a poker run is just like playing a poker game, but you ride to different locations, different distances through scenic country, and you pick up cards to play a poker hand. And those poker hands, at the end of the day, the best poker hand gets the best prize, whatever it happens to be that the committee has pulled together. So that's kind of how it started for me. The Ride for Dad has since expanded from motorcycles. They still include motorcycle rides, but they also now include an ATV ride, a snowmobile ride, and a watercraft ride. So it's all, the focus is to get people out, to make people in the communities aware about prostate cancer, and the charities that are set up in those locations, whatever funds they raise are to go into those communities and raise awareness for prostate cancer. Because, like, as we've been talking about, the stigma, men just don't want to go get tested. And as Leo had said, as soon as he heard the word cancer, he didn't hear anything else. And that's the key thing. Now we're giving people information, people that are coming into our age categories that need to be tested to make sure, because early diagnosis is the best way to go so you can get treated. So the Ride for Dad has been one of the entities that I've worked with. It connected me to the local prostate cancer support group that's here, and we worked hand in hand with them on these rides. Made several good friends in there who are prostate cancer survivors, and they have stories very, very similar to Leo's. So statistically, I don't think I would be able to give you figures from today, because they're usually a couple of years in arrears. But like you said, 1 in 9 men can be affected by prostate cancer. And as I'd said a little earlier, the group that I was with, there was 20 of us, and I just sort of looked around at them and wondered, like, so 2 of us in here could have prostate cancer. Who are they? And nobody would be able to know, because none of us had been tested. So that's kind of what brought me into the prostate cancer awareness side of things. There are other events in areas where they try and raise the awareness of cancer, prostate cancer, and that sort of thing. Early detection gives you a greater success story if it is diagnosed as prostate cancer. I think you'd mentioned earlier about enlarged prostate. It's a different thing. It's benign, but it still needs to be treated. But it's similar symptoms, I guess, that you would have. So the idea is to get the awareness out into the communities, and for us, hopefully everybody from our Métis communities around the province at least listen to some of this. And it's usually the women who are the strong ones in the family who would say to the husband, you need to go get checked. You know, you're over 40 or you're over 50, or your grandfather or your father had prostate cancer. You're in this category. You should go get checked, and be supportive in terms of that. And I think that would help the men get over that stigma to get out and get it checked.
I think that's a really good point that you raise. And, I think it's really difficult for men, because typically they have been conditioned to be, as we mentioned earlier, to be strong and to not be vulnerable or to not be weak or anything like this. And, really, if you're faced with a cancer diagnosis or the possibility of cancer, that's really frightening. And, to feel like society has made men feel like they can't express fear, or they can't be afraid of things, or that somehow it's interpreted as weakness is really sad. And I know, in my family, because I have 2 sons as well, is, that's something that we've really talked about that. We've talked about, the societal view of men having to be strong and everything. And I just would like to share that, that there are those of us out there that believe that we are all human. And as being human, we are subjected to feeling frightened and scared and afraid and alone. And, we shouldn't promote that in our men, that they can't be vulnerable, or they can't feel as if they need to cry or need to talk or anything like that. And I'm really grateful that we're having this conversation and that I can participate in it as a spouse and also as a mother, because I really would like to see that change. I'd like to see that change.
Yeah, exactly. And I think the big thing is and just to highlight, you said, men don't talk about it. It's been the way since we were born. Like, you're the big strong person, you're the provider for the family. Well, what happens when something happens to the provider and he can't answer that question, or he can't deal with that situation because he's not able to? He needs support from his family.
It's also, thinking about the whole provider breadwinner kind of ideal as well, and acknowledging the stress that could cause, especially if you are the person who has, the higher income, or you are the person that is working. It creates a whole other level of, I think, mental health issues that I think are, another sort of topic of concern when we're talking about prostate cancer in men.
Yes.
And, the fact that this is something that happens primarily, not all the time, but in men who are older, you've lived, a whole portion of your life before you're actually faced with this. And, you might be looking at things like you might be close to retirement or looking towards retirement or something like that. And all of a sudden this descends upon you. So I really think, and, for those supporting men out there that are listening to this, that we really need to be aware of the psychological impacts that this could have, and encourage the men in our life to seek help, to seek that support, and to reach out, and maybe even to each other, and have a conversation about this where they can just be themselves.
Yes, certainly.
Yeah.
And I think that's part of the stigma. I kind of picked it out when Leo was talking. When he found out he had prostate cancer, he didn't talk to anyone. And then after that, it was after the treatment, it was the fear of the diagnosis, the fear of the treatment, and the recovery. So all of that was foreign to him. He had no idea where he was going. As he said, when he got home and his wife had all these questions, he said, all I heard was cancer. Yeah. So yeah, there's going to be some mental health issues there. I think the big question, why me, and why now, and why? So there certainly needs to be some supports. I know from Prostate Cancer Canada, they are a national entity, and they have support groups in a lot of the communities. I know here in the Comox Valley, we have a Prostate Cancer Canada support group, and they're there to help someone who is newly diagnosed with prostate cancer and this sort of thing. So I'm not quite sure if there are any mental health supports there, but I know that they do have a good support system. I'm not sure how far around the province it is. I can provide the website for it, and people can actually go and have a look and see where the support groups are.
Thanks, Dave.
You mentioned a good point there about aftercare.
Right.
And you know what? After you are given your diagnosis, you go through your treatment, you are carrying on with your life. What about aftercare? What happens after? Like when it's done, you're changed. There's something else. But I wonder, what you fellas think about that, or what you know about that. Life after cancer.
So it's Lloyd here. Having several family members that have gone through cancer, and one my father passed, but through his whole journey, which was 6 years in length, the aftercare, he was supported by the BC Cancer Agency. I was so impressed. We had counselors available to us. We had social workers. We had OT, PT. We had all nursing care. Basically, it was there for us to help support us through the journey. My other family member who is a survivor, same thing. Because after the cancer is gone, and Dave talked about the what ifs, what if it comes back? And that's a big one that weighs on your mind. constantly, what if it comes back? What if I get another type of cancer? And that's one thing with prostate cancer. After you've been treated, you have a higher risk for a different form of cancer coming. So, and we all have stories to tell about people who have had cancer and then get another form of cancer. So, or that cancer had metastasized somewhere else. So that's a worry that we have. And I know for the family member that we had counselors available for us to deal with that anxiety that comes with it. And one thing that Leo that I really said that I really want to mention is the relationship with your doctor. Talk to your doctor. Don't keep secrets, because he can't help you if you keep a secret. And he said that with the incontinence. He didn't tell anybody, because for a male being prideful, now you're leaking. That's hard to handle. And I'd like to just comment on what Dave said about how you're brought up. I was brought up in an old style family where the man was the man. He never cried. He didn't show his emotions. So, and as I've gotten older, I've struggled with that. And so I imparted the same knowledge to my two boys that Destinée did to hers. And I really think that our old style of being raised is slowly going by the wayside. It makes us more vulnerable, and I think that's in a good way. So thank you so much for bringing that up, Destinée.
Yeah, that's exactly it. The not talking about it is the worst thing. The aftercare and the support is another thing. And I, much like you, grew up in a home that the men were the stoic people of the family. You know, even though I was a little boy, I was expected to take on some of the tasks. Then I joined the military, and it's a totally different environment, but very much, I won't say male dominated, but you're expected to do the things that you're trained to do whenever is asked upon you and not complain about it. So you just don't, I won't say the word would be complain. You just don't let people know things are bothering you, because it's not expected from you. It's, I guess it's a reality of life.
And I know being in the military that, you know, the expectation is a certain way, but I'm hoping that, you know, as the military evolves and as we all evolve as human beings, that, you know, we're able to kind of look at the sort of gentrification that has occurred, and how you are a man and therefore you have to do X, and you are a woman and you have to do X, or even just the abolishment of all of that, and just getting back to the fact that, as I said earlier, we're all human beings, and we all, you know, we all need each other, and we all deal with things. And I think that, you know, as a Métis person, I really appreciate, you know, our ability and our capacity to have, you know, the relationships that we do with each other and with our communities. And I think that, you know, we all can be advocates for prostate cancer, and we all can advocate for getting checked, and we all can advocate for health. And I think so many of the things that we've discussed on this call today are going to be so helpful to men and women out there, and you know, everyone who has questions or who might be struggling with getting checked or is afraid or something. And I really want to thank you guys for kind of putting it out there, because that's what it's all about. It's about putting yourself out there. And I recognize that this is mostly a male experience, mostly in the physiological sense of the word, but there's others that are involved as well. So it has really been a great discussion.
Yeah. So, as I say, looks like we're getting close to winding down here, there's just a couple takeaways for me that I would like to share. Is one, the relationship with your family is so important. Regardless of what trouble you go through in the journey of life, work together. And be a partner. Whether you have to support your wife through her journey as we get older, and vice versa. Signs and symptoms. There's a whole lot, but 9 out of the ones that I got from the Canadian Cancer Society, and I think when you're Googling, because we talked about, Leo mentioned the importance of what you can Google. Be careful what you Google, because there's stuff out there that can lead you down a wrong path. You can't go wrong with the BC Cancer Agency or the Canadian Cancer Agency. They're going to give you the standard treatment and diagnosis and everything like that. Signs and symptoms, I can give them all to you, but if you work with your physician, because I know when I've gone in for my physicals, and that's another thing, is go in for your physicals, get your checkups, and we've heard that over and over again. Signs and symptoms, the first thing they're going to say is, how many times do you get up in the middle of the night to go pee? What's the stream like? 9 out of the 15 symptoms, signs and symptoms for prostate cancer are around your urine flow. So just beware. I mean, we darn well know. I mean, my father's in his 80s, and every 2 hours he has to stop and go to the washroom. So we know that he has what they call an enlarged prostate. He doesn't have prostate cancer. It's just enlarged. So, so just be aware of that. It's all around your urine. Side effects from getting your prostate checked, after talking with my physician about this, and then my son, basically most of the side effects from the surgery or the care for prostate cancer, if you work with your physician, most of them can be taken care of. So that shouldn't be a concern. And when you hear those horror stories, say, yep, but a lot of those people aren't working with their physicians or their healthcare team to manage them. And Dave, what an awesome honor for me to sit here and listen to your story, and for Destinée, again, an honor for me to be part of this. So those are my last words. Dave, would you like to
I
part us
just
with some
like
wisdom?
to, I guess, make a point about, and you had said about your annual check, and I guess it's to support that. Some people may say, I don't have the time to go out and get checked and this sort of thing. If you make it a birthday where you do your annual physical, you include the digital check and ask for a PSA check at the same time. You're going to go get blood work done anyway for your annual physical, and the PSA reading can come out of that. So there's two things that can be done, and without putting it off. You got to go for an annual physical with your doctor. Then that's the time to make that decision.
Dave, when I got my PSA done here, I guess it was 2 months ago, I had to pay $20. Is that at the norm?
Yeah, it depends. I think it's the 20 or 25. However, if your doctor knows that there's a hereditary connection, example being if your father or your uncle or your brother was diagnosed with prostate cancer, then you're susceptible to it. So the BC healthcare system, I believe, will cover that cost. Whereas if there isn't any, and you just want to know for sure from a specific learning point for yourself, or to just to make sure for yourself, it may cost the $20 or $25.
I have a question actually that's kind of surrounding age. So if I'm a male and I'm 35 and I have a history of prostate cancer in my family, should I be talking to my doctor about this at 35 and say, I have this in my family? Or is there actual ages which would be considered too young to ask for this? Yeah, or would I be met with resistance? And in either case, if I met with resistance, how should I move ahead with that? What would be your advice?
It's a good question. I had mentioned it before about talking to your doctor. The age group, I believe, is 50 and above to be checked. However, if you have it in your family tree, you can get checked as early as you want. Some 35 isn't a bad age. It gives you a baseline marker to work from. As you go through your annual physicals, you would then find out whether or not your PSA levels are elevated or not. And it will be a marker for your doctor to be able to advise you.
one thing about your PSA that they don't tell you all the time, that if you're going to get your PSA done, make sure you don't do anything very rigorous before the day before, or even a couple days before you get your PSA. So no riding a motorbike, sexual intercourse can increase your PSA levels. So just be careful that the day or two before you sort of stay on the low and low, because you can get a false positive if you do any of those activities before you go get your PSA.
Yes, it's a good point.
I have another question about PSA actually, is if you get a PSA test done and do they have a way of knowing if it's a false positive or not? Or is it either positive or negative? And then there's follow-up. Is there ever reason to take another test just to verify if there was a false positive? Or would it be related to activities similar to what you just mentioned that would prompt your physician to order a retest?
That's a good question. My PSA tests have always been in the normal level, but I would suspect that, and this would be a good question for a doctor, what would they do if they saw a spike or a rise in a PSA evaluation? Like I said, you get your baseline and it tells you what you're at. And then maybe 2 years later, it's a little bit higher. Was there reasons for it? Was there any of the activities that Lloyd had mentioned earlier that could affect it? Did those occur before the test? If that's the case, then maybe the doctor would need to have you retest it again. So the idea that is that your PSA has risen from the last check or from a subsequent check. That's what they would. I would think that would be the thing to do. But then that's a medical doctor's call there.
So I actually asked that question because I just was kind of preempting, and I also have experience from my friends who've had elevated PSA tests that they've gone back in, depending upon your physician, within 2 weeks to get their PSA redone. And that's a normal thing. As I say, they're looking for a trend, and that's why it's really good if you get it done on a regular basis. They can look for a trend in your PSA level. They're looking for a trend.
Yeah, and I think Leo had mentioned that most men over 80 have some form of cancer. I've heard stories, and I don't know, if they're true or not, but that older men have died in their 80s and 90s, and when they were autopsied, they found that these guys had prostate cancer and didn't even know it. They didn't die from the prostate cancer, but they had it.
Yeah, I've heard stories the same too. So, Destinée, did you have any takeaways from today's that really hit home for you?
I have a lot of takeaways from today. I feel like I have been given this secret opportunity, maybe not secret, but this inside opportunity and the inside scoop into men's health and into what are men thinking about prostate cancer. And I can tell you that the whole experience, our experience working together on our panel, working with Leo and with you fellas over the past few months has really changed my perspective on it. And, it may have been something that wasn't top of mind for me as a woman, but, as a woman supporting men in my life now, it's really changed me. It's changed how I look at it all. And also how I look at the other men that are present in my life. I don't have my dad anymore. But, I just think that other people have dads. And as a regional health coordinator, I think we really need to be proactive in our communities at speaking with our men and saying, this is something that we really need to be proactive about. And we're so fortunate to have, an advocate present on our call and hear from a survivor. So we know that it's not all bad, but we need to be proactive. So my takeaways are to make sure I'm supporting my man, as Leo said, and I have sons as well, and also being able to spread the message as best I can and to give guys a break. I'm going to give the guys a break. It's not all about being tough all the time. Sometimes it is, but not all the time. So those are my takeaways. Thanks a lot. It's been an honor to be with you guys today.
Yeah, if I could just say one last thing. The question that should be in every men's mind is, do I have the answer? You're actually sitting on it. go get it checked.
Thanks, Dave. Those are great words of wisdom. So I'd like to, before I close, I'd like to put a thought out there. I really, and I've chatted a little bit, but we need to have men's health awareness, whether we have a day once we get out of this COVID-19 pandemic or whether we continue doing it virtually. But I really think we need to look at a men's awareness avenue. We always have women's groups, we have this, but if you look around, we don't have anything for men. And I think it goes back to how we were raised, that we don't share, we don't show our emotions, we don't there's a lot of things, and as I say, there's a lot of things that not talk. When I talk to the women's, there's ministry, there's nothing out there that says shows men how to be fathers. No, nothing out there for men to be husbands. Because we weren't taught that. My role model never taught me that. I mean, I've had to learn along the way, and thank goodness I have a very understanding wife, but there's nothing out there. So, and as far as health-wise goes, I was always told, suck it up, buttercup. And so I really think that that's not what being a man is about. And it's not good for our health. So I would like to ask the Creator to look over us, to show us the way, to share your leadership and guidance, to work with our spouses, our loved ones as we go through this journey in life. I thank you for the guidance you've given, the guidance that you'll give, and the fruits that you've given us. Thank you very much.
Thank you.
Okay. Anyways, please contact us at any time. We're more than willing to work with you. Thank you, guys.
Thank you very much. And as my co-host, my host has suggested, if you would like to see more of these kinds of videos, please let us know. We're more than happy to do this for you. Thank you, everyone.
Yeah.
It's been excellent. Have a great day.